Everyone, and welcome to another audio podcast as part of a Labside Archetype edition. This is an audio podcast as part of another Labside Alchemy, and an audio podcast as part of another radio edition, another Bostics Blast, and another Storm of Bostics production. In this audio podcast, there'll be an overview in around works that originally was developed in around between 2004 and 2006, and this works was or revisited at least in sort of early 2023, and was presented at the International Pediatric Transplant Association 2023, and this looks at transplant neuroimmunobiology, the immune system, transplant rejection, and neuroendocrinology, and retrospective. So in around this overview, part of this overview, in around the background, leukocyte and lymphocyte migration or trafficking from peripheral blood into affected tissues is an essential component of the inflammatory reaction to virtually all forms of injury, and is an important factor in the development of many diseases. Advances have highlighted the central role of chemokines and cellular adhesion molecules. Molecules or CAMs have also been important in acute allograft rejection, or AR, since these molecules allow for protein receptor binding. So around the aims and objectives of this works, the aims here was to highlight how specific immunological and neuroendocrine markers can reduce chemokine migration in acute allograft rejection, or AAR. In around the sort of mechanisms or the mechanistics, the pre-transplant phase, or looking at pre-transplantation pre-transplantation sort of immunology and pathways is as central as post-transplantation post-transplant as central as post-transplantation, and it is postulated that has been postulated that Hansen's general adaptation syndrome from 1936 and specific neuroendocrines should be considered surrounding allograft prognoses. In and around the literature, this works seeks to integrate literature surrounding immunobiology and neuroimmunobiology to better understand AAR post transplant, in around post transplantation, in around the analyses. So investigations uniting immunobiology and neuroimmunobiology and AAR are still rare. Conclusions, and around the conclusions based on Selly's works from 1936, it is postulated that chemokines appear to be integral players between immunobiology and neuroimmunobiology. And so using a multidisciplinary laboratory practice should encourage understanding of acute allograft rejection, or AAR, in around certain terminology similar to this works. similar terminologies in around this works includes physiology, chemokines, endocrinology, immunology, and chronic kidney disease. Thank you for tuning in on this audio podcast as part of another Labside Archetype edition, a part of another radio edition under Storm Lobostics production. This has been an audio podcast as part of a Labside Alchemy and another Bostics Blast.